This is Walsall College Radio, bringing talent to life.
Okay, so what's your name and what industry are you from?
My name's Sarah Greswold. I'm a nurse with Dudley and Walsall Mental Health Trust.
My name's Alicia Dean and I'm a primary care mental health nurse from Dudley and Walsall Mental Health Trust.
What is stress?
Stress is how we describe the pressures that are placed upon us. It's not necessarily a bad thing, although it's quite often thought of as that, but it's really how we deal with our life events and the things going on around us.
When talking about stress, what is the main stuff to look out for?
There's many signs of stress, but people will act differently depending on varying factors. The more common signs of stress are sleeping problems, lack of appetite, you may overeat or you may undereat, fidgeting or the inability to keep still, sweating sometimes when people are under quite a lot of pressure. Stress doesn't just affect your body, it also affects your thoughts and your feelings as well. People may experience racing thoughts and constantly worrying about things, and they can't shift that worry, so it's always in the mind. They might feel the inability to actually clear the mind of anything, so that thought will be in there all day. A person might experience irritability, losing their temper, and have little patience with others. But like I said, there's very varying signs dependent on the person.
What sorts of stress are there, and what can trigger those types of stress?
Stress can come from a number of different sources. We tend to think of stress as either acute, so things that are happening quite short term, so that could be an exam or a job interview, or we think in terms of quite chronic, so that might be difficult relationships, ongoing money problems, but they can come from home, from work, from school, from college, and pretty much every aspect of human life really.
You've just talked about college and school. How would stress affect young adults different to what it would affect adults?
That's quite a difficult question because obviously we're all individuals and we all react in different ways. Biologically, young adults and older adults will react in the same way, so they'll have the same sort of response to acute stress, so increased heart rate, increased breathing, sweating, tense muscles. But younger adults might find that they're not always sure about how to access support, whereas older adults who may have had experiences before or had friends go through similar experiences might feel a bit more confident about approaching their GP. We'd hope that young adults would access the support services within the college environment itself, but also feel comfortable to come and talk to the GP and access the mental health services that we work for. But young adults can quite often feel embarrassed, which they don't need to at all, and they can quite often worry what their friends will think, which again, most people do have a very positive experience when they start to discuss difficulties with their friends, and they find that most people are experiencing similar things.
How can I then try to avoid unnecessary stress?
I think stress is quite normal for a lot of people these days. Stress, yes, it does make us feel very pressured at times, but it can be helpful in certain situations. It's just when it goes a bit overboard, that's all. It can sometimes feel too much for the person, but usually people can cope with it. Like I said, it's unavoidable, but as you get to know yourself, as you get older, maybe go through exams, going into college or going to university, you'll know your own triggers and what might trigger your stress off. It might be sometimes financial reasons, it might be that there's just too much coursework to do, and that's the time then you really start need to think about, how to manage your workload and what you can do. So it is just management of yourself and recognising your own triggers.
How could I support someone that's suffering with stress-related problems?
I think the first thing probably to do when you know that somebody might be suffering from stress is to actually just talk to them about it. Talking really, really is helpful to a lot of people, and a lot of people that suffer from stress hold it in. They don't really want to talk to anybody about it. So we always would suggest, if you do know anybody that is suffering with it, just say, are you okay? Just that general question, are you all right? I've noticed that you're a bit sort of quiet lately, or I can see that you're getting a bit irritable. What's going on for you at the moment? Obviously, not everybody wants to talk about the stress-related problems, but just even saying, I'm there for you. Sending them a text, just saying I'm here if you need to talk, a phone call. In terms of relaxation, I suppose, it is about trying to relax with it, but actually taking part with them as well. Relaxation isn't just putting a CD on and just lying still. It can just be going down for a coffee, going to the pub, just for a Coke, anything like that. It's one of those things where relaxation just doesn't mean just sitting still. It can just mean just actually talking to somebody in a different environment, different surroundings.
How would I know, or how would somebody else know if they themselves are suffering from stress?
That's a really good question, and that tends to be something that people assume that they'll recognise, but quite often it is their friends and their family that will notice that somebody's finding things difficult. The things you might notice are changes in your appetite. You might be eating less, you might start to lose some weight. Other people find that they comfort eat, so they might gain some weight as well. Your sleep might change, you might struggle to get off to sleep, or you're waking up during the night. You might find that you aren't wanting to be as sociable anymore, so you're declining invitations. You might find a lot of avoidance behaviours as well, so if you've got deadlines to work to, particularly with college work, when people are feeling overwhelmed, they tend to avoid things, so they put it on a back burner, which actually makes it worse.
With close family and friends, people who are around someone who's stressed, how would they be affected?
It's going to probably affect, obviously, relatives, friends, distant family, close family, probably quite a lot. It's not very nice probably to see somebody suffering from stress, and they probably feel very sort of out of control and won't know what to do to help that person. But it's just going back to just talking to them, really. And obviously it's the fact that it's going to have a massive impact if you see like your child that's stressed out, but also it's going to affect them, and it's just about talking all together and supporting everybody. It's got to be inclusive, and I think that obviously if the person is stressed and they know that it's worrying the friends and family, just saying, I am stressed out, but I'm okay. And if they're not okay, just talking to everybody about it.
You just said about talking to people about it. What professional help is there for people who are dealing with stress?
Well, the first thing I would say is actually just to recognise first off that you are stressed and that you actually need the help. Some people are very, it's absolutely fine for them to just deal with it themselves, and then they manage it quite well. Obviously talking, like I've said, throughout to other people for support, but if you know that isn't enough, that the first point of call would be to go to your GP. Obviously, if you haven't got a GP, you'd have to get registered, but they're the first point of call for you, really. They'll talk about medication, they can talk about one-to-one counselling, but there's also organisations such as Big White Wall and COOF, which is a counselling service which can also help. It might even be that the GP might talk to you about doing group work, a therapeutic group environment. So there are a lot of options, really, not forgetting places like Samaritans and also, mental health websites such as Mind.
There's lots of support out there. It's just a case of encouraging and supporting people to access it. There's lots of things you can do to help yourself. Talking to friends and family, managing your lifestyle are things that you can do immediately. Obviously accessing external support like talking to your GP. Your GP will be able to direct you to our services, the Dudley and Walsall Mental Health Trust. So within that service we're able to offer a whole range of things including information, self-help leaflets, talking to a nurse like myself and my colleague Alicia. We can do group sessions which people find extremely helpful, and they come and share their experiences. We can point you in terms of specific websites that can offer you support. So there's lots of things out there, but something as straightforward as going to your local library, and there's plenty of self-help books there that are very, very good as well.
This is Walsall College Radio, bringing talent to life.